Hello and welcome. My name is Donna Cryer, and I'm the founder and CEO of the Global Liver Institute. And I have the honor of being your host for this GLI Live. I am so excited today for this episode on the day before International NASH Day. Although many of you have been celebrating for weeks, or at least recognizing the seriousness and urgency around addressing this epidemic of NAFLD and NASH for weeks now, and we could not be more grateful and excited about that. But today I have a very special guest who did so much to this field. Professor Jeff Lazarus is the Vice Chair of the EASL International Liver Foundation, and the EASL International Liver Foundation has been a fantastic leader and partner on setting the global NASH agenda, and specifically creating the evidence base for us to create appropriate and hopefully effective policies and interventions. So, Professor Lazarus, welcome.
Thanks so much, Donna.
Thank you. So, I have admired your thinking, your approach to NASH and to liver health as a whole for so many years. And so I've been really grateful and have learned so much from you. So grateful for this partnership, and really excited to give this platform to the incredible work that you've been doing. But before we dig into that, I just wanted to get your assessment of the past 12, 15, 16 months, really, and the impact that COVID has had on liver health programs and policies from your point of view in Barcelona.
Yep. So thank you. And you're really, on behalf of the EASL International Liver Foundation, we're grateful for all the partnerships, particularly with patient groups or NGOs that are led by patients like the Global Liver Institute. It's great to be able to collaborate to address this under-addressed issue. And in terms of the impact of the pandemic on liver services, on liver health, I mean, in my opinion, but also drawing on the evidence, it couldn't be much worse. I mean, in countries where the health system was overwhelmed because of COVID-19, one of the first things to go was, regular checkups, prevention campaigns, awareness campaigns, the ability to reach the hospital in countries with lockdown, the ability to reach your provider who in many countries may have even had COVID-19 or was turning their attention to patients with COVID-19. So the impact has been quite devastating and is still going on in many countries, including in Europe, but also particularly in countries like Brazil and India, parts of Africa, where the pandemic is picking up. And some of the things we've been thinking about, what do we do? How do we address this crisis? And I think it's about not to be cliche, but it is about turning the crisis into opportunity. I mean, this was an opportunity for governments and health authorities and experts to say, now you have the time to exercise more. Now you have the time to focus on your diet more. Key issues and interventions for people living with NAFLD or NASH or at risk of it. Instead, the population often turned to a sedentary lifestyle, more junk food, more alcohol. So it was a hugely missed, opportunity at a time, in our country, some of our European countries where we had a lockdown and we could have been thinking more about how to improve our lifestyle.
I think, though, there is the recognition that liver health is public health and needs to be integrated into that public health agenda because of the vulnerabilities of people with liver disease, with obesity and fatty liver disease to COVID. It's not optional to address liver health and think that we're going to get on top of the other pandemic of COVID, or move forward in a way that can have a healthy citizenry, a healthy countries and communities. So at least I think that through line hopefully is the takeaway from all of this?
I think we can agree that it's our takeaway, and probably for many
our job
colleagues, for many of our colleagues in public health, and and from the patient perspective. But I'm not sure all of the authorities have really understood that, one, liver health needs to be a cornerstone, a central part of public health. But everything I said about more exercise, better diets, all of that helps your COVID-19 outcomes. We know that with a respiratory infection, there have been poor outcomes. It's been more severe in obese population. There's also a greater risk, as well as those with diabetes of NAFLD. So the other issue, since you mentioned public health, is that the pandemic really highlighted and exacerbated existing inequalities. So I say, we can improve our diet and we can exercise more, but a lot of people don't have any access to green open spaces or indoor exercise equipment. So those at most risk of NAFLD and NASH during the pandemic, also became at greater risk.
Absolutely. And we will have to make sure that coming out of this, that is not forgotten, and all of the structural inequities and necessary supports for a healthy lifestyle and a healthy liver lifestyle are put into place. And so, we can't be siloed in our thinking and look at the medical interventions, although those are necessary to get people back into care, back into screening, back in, on schedule with their checkups for all of their liver health, their cardiovascular health, their endocrinology. And I, shared before the visit, I just was having my own endocrinology telehealth visit before this episode. And so ensuring that every person in every environment has the infrastructure necessary to be able to get that care, but all of the things that surround and enable a healthy lifestyle, the food and movement, are important parts of that as well. You're absolutely right.
Yeah, since you mentioned telehealth and even your own visit, I think another takeaway from the pandemic is that we need to move much faster towards telemedicine, or what I like to call telehealth, or digital health, whatever you want to call it. It's always been something like we've started on, and we have apps that some people use. We don't really see the doctors prescribing recommending apps and digital health as much as they could, but we've seen with the collapse of health systems, the importance of digital health. And for NAFLD and NASH, this can be crucial. Piggybacking or linking with existing apps around diet and exercise. I think half the world seems to be counting if they're reaching 8,000 or 10,000 steps every day, but why not link all that together to understand what it means, for liver health, rather than where we more traditionally, see these apps focused.
I absolutely agree. I think it gives some context to doing these activities, the why for people. And it's not just sort of a nice to do, but if there was more feedback on the changes and improvements that these were giving to your liver health, I think a lot more people would, be engaged, would figure out and find the time for it in their, their life flow, as my friend Mark Booten likes to say so well. That and I think that's important to help people figure out really how, in the context of their lives, this type of movement fits in, and how it pays off in the near and short term, because just the long term, you're going to live to be 100. That doesn't really motivate anyone. But does it, allow you to play more, work more, give more for your family? Can we give some feedback loops through digital that show people that, even the small changes have a positive and meaningful effect?
That's right. And getting those, that digital health, at a time when you can't get to the hospital, to start, making sure electronic health and medical records can link, maybe to wearable devices, and we can just all start communicating more and not as much face-to-face. I think face-to-face is ideal, but we've seen the last year and a half that it's so limited, and we just weren't prepared. So instead of, losing access to healthcare, we need to really, speed up the focus on digital health. And I think particularly in liver health, there's a lot of opportunity. I say that because there's so little happening, unfortunately.
Everything is happening. That's how I that's the only way I'm able to sleep at night, just breathing deeply and being like, it's just all opportunity.
Yeah.
But we've had the opportunity to work together, in parallel and alignment on putting together what the plans for every stakeholder in NAFLD and NASH, and how everyone can move forward together to really address this. And I think that the work that we've all done together now, and we've had our 70 members of our NASH Council. Your process with Wilton Park was so inclusive of dozens and dozens of thought leaders as well. Many of the same folks. So this is good because we kept it consistent with each other. But really, we've both worked to break this large challenge into manageable steps for action. And so let's discuss what some of those are. As we go into International NASH Day, tomorrow and over the next following days of activities, I think that's great from an awareness perspective. So people will need to know what we want them to do, not only tomorrow, but for the next 364 days. And so, tell us maybe about the Wilton Park process and plan, your intentions for it, and then we can talk about some of the takeaways.
Yes, I mean, as you know, Wilton Park is a global think tank based in the UK, but it's been around since 1946, and its remit has grown from security issues to now include environmental issues and health issues. So we engaged with Wilton Park to harness their convening power for two events. One was focused on models of care for NAFLD and NASH, so we can start thinking about who's going to see people with NAFLD. Do they need a specialist? What kind of risk stratification do we need to make sure the right people reach the specialists and others can stay in primary care and get the kind of prevention and even structured lifestyle intervention treatment that they need without necessarily going, for example, to a hepatologist. So we had two meetings with Wilton Park around models of care where we came up with 8 recommendations. They'll be published soon, in any day now, I hope, in Nature Reviews, GastroHep. But the recommendations are about the importance of multidisciplinary teams, about non-invasive tests, about co-located services, recommendations about how to make our models of care more fit for purpose. Some clinics, some countries will move faster than others, and we also highlight some settings where they're already doing this and doing it well, although that's, I could say, not the case in most of the world, but there are good practices to draw on. From there, if I was going to tell someone, well, what are you going to do? Like you said, the next 364 days of the year. Well, first, we really need to increase awareness. Again, it sounds pretty cliche, but people do not know what NAFLD is. They don't know what NASH is. They don't know what fatty liver disease is, and they don't even know, if they understand the words, they don't know what to do about it. What is that? What does it mean when you have a fatty liver? What does cirrhosis mean? What is end stage liver disease? So we need to do a lot of awareness raising to understand liver disease, and its role as a component in metabolic syndrome. I'm not going to enter the debate, but we do need to talk about the name. So I will just say NAFLD and NASH, because we know it can be so stigmatizing, referring, even if you're saying non-alcoholic fatty liver disease, the minute you bring in alcoholic, it does raise an issue. The next thing, and this is with my researcher hat on, is we really need to expand the evidence base. So my approach in NAFLD and NASH, as a non-hepatologist, has really been to take a public health and health systems approach. That's why we looked at models of care, just like we had done earlier in HIV and in hepatitis C. We said now is the time to start really thinking about the kinds of models of care we need, how they can best be implemented, and to start studying those issues around what kind of risk stratification works, what's most cost effective, and so on and so forth. And then the other issues is, now we're on, you're the Global Liver Institute, we're the EASL International Liver Foundation, and, we can meet in Wilton Park or meet virtually, and we can have this webinar, but we really need to get this messaging down to the national and the local levels. There's still a lot of sort of highfalutin publications, and I'm guilty of this, where we're kind of writing to each other about what we need to do, and we need to really bring it home to national stakeholders, to city level stakeholders. Big success in the HIV movement was to get fast track cities happening, to involve mayors, and same with the whole healthy city movement, which is so important for NAFLD and NASH to have places to exercise, green spaces, to secure a healthy food supply, in different cities. So it's really, I would say, raise awareness, build the evidence base, and get this down to the national and local levels.
Jeff, as you know, I agree with you in every point of that. Which is
it won't be much of a debate, but anyway.
Have that every day, for the darker times that are more contentious, but I'm with you every step of the way. And, when we were thinking about how our U.S. NASH action plan could, be in alignment with that, we decided to be very concrete for each stakeholder group. So there was no lack of clarity and no confusion about if you were a medical society, do these things. If you are a patient advocacy group, you can do these things, and are really working throughout the more than 70 members of the NASH Council, which range from patient advocacy organizations to fatty liver disease clinics to minority serving institutions and community organizations, and just asking them, which part of the plan do you claim? Which element works within your strategies and your capabilities to move forward. And certainly, as we have built our Liver Action Network and are now in 39 states within the U.S., moving down to that city level, community level, and saying, okay, what can you sort of pull down and take on in your own town? And then when we look at it in the aggregate, then it does become something that moves the collective needle. But when we have a better understanding, from CDC in terms of improved surveillance, and really understand how not just obesity and diabetes, which I think we've mapped very well traditionally, but NASH specifically, so that we can take those to municipal leaders, congressional leaders, and talk about how it's affecting the people in their communities, and hopefully compel action and programs. I know from past experience building cardiovascular risk reduction programs in states like Mississippi, where the key issue was access to healthy foods, lack of cardiologists, particularly cardiologists of color, but lack of healthy foods. And so even putting in mobile food markets, healthy food markets, and just really thinking what is the key, what is the local solution or need that would help move the overall effort forward, I think is absolutely where we need to be working now. Out of these sort of general principles, and everybody agrees on them, are set by our organizations. It's really the rolling up the sleeves part, and people buying in and doing the work. So
yeah, a strength of that U.S. NASH action plan, which is really a model for the world, is the inclusiveness of so many different stakeholders. And like you said, the involvement at the local level, thinking about food systems, and circling back to what you said earlier about public health policies. This isn't about siloing the liver. This is about getting the liver into diabetes and obesity action plans. So when we surveyed 102 countries to see how they were addressing NAFLD and NASH from more of a public health perspective, largely a non-clinical perspective, although we did ask about clinical guidelines. None have an NAFLD or NASH strategy. Now you do in the U.S., but before, last year, now it's 1 out of 200 or 102 that we surveyed. But even in diabetes and obesity strategies, no mention of NAFLD or NASH, no mention of the liver. And if you just search for the word liver, the only time it comes up is in the word deliver, but nothing to do with it. So, so this is a big problem that even the other fields, the obvious fields, diabetes, obesity, but even cardiovascular disease, aren't aren't paying any attention really to liver disease or NAFLD and NASH specifically. So, another thing we need to do is really embed NAFLD and NASH into the non-communicable disease agenda. So we started off talking about public health, and I would add to that the Sustainable Development Goals agenda, the SDG agenda, where liver health is non-existent except for viral hepatitis B and C. And I remember that fight that was led by the World Hepatitis Alliance and other patient groups to get hepatitis or viral hepatitis into the SDGs, which are supposed to be not as narrow and focused as the Millennium Development Goals, but more integrated. Liver is largely left out. So we need to get this into the WHO reports on non-communicable diseases. We need to get, we need that kind of leadership from WHO. So even though I'm talking about what needs to be done at the local level, we need that top-down approach at the same time. And I would say, and I think you'll tell me if you agree, that this is about health. This is about good practice. This is about the entire package of sustainable development goals, which also includes urban health, but development, gender issues, partnerships. And I'd caution against making just the economic argument. The economic argument is there, but it's not necessarily the central argument. So with Jörn Schattenberg and others, we recently published a study that just showed the devastating effect NAFLD and NASH will have in coming years on productivity, being equaling, time equals money. But I wouldn't just focus on the economic argument, although I guess some policymakers are going to want to hear that as well.
That's a fantastic lead-in to the fact that we do have a WHO video prepared for tomorrow about their commitment now to NASH, and they did participate in our global NASH is a Global Public Health Challenge panel, so people can register to watch that panel tomorrow, and we'll be showing it twice. We recognize how many time zones we come across now, and so it'll be played twice and then available afterwards. But you're right. Having worked for over a year to get those meetings and that recognition by WHO that the liver health, and I think GLI has always been about positioning and refocusing perhaps on liver health rather than liver disease, because we felt that was the best way to move this into a positive public health position and approach. And in the same way that people think about their heart health or their brain health, and just in positive integrated ways that come across food and movement, and even energy and climate policy, because the liver's role in filtering toxins, and you can't you really can't have optimal health without great liver health in this sort of toxic climate environment, and it is having effects. And so we do believe that and certainly learn lessons from and appreciate the work the World Hepatitis Alliance did, which was one of the first things I joined when creating GLI. But I felt it didn't create the umbrella for the other liver conditions to sort of come behind. But I think we have this opportunity with fatty liver disease and NASH to really create this, to bring all of liver health forward, to be integrated into the larger goals. And so, there's been so little done in the liver in the past that it's nothing but opportunity. But I do think that there is an opportunity for liver health as a whole, since everyone has a liver, except for us for the few moments that ours are being transplanted. And so everyone is at risk of a liver disease, or should be concerned about their liver health. And that message, I think, cannot be overstated.
Yeah, I think when a country has a high, and prevalence estimates are so poor, but where they do exist, when the country has a high prevalence of NAFLD or NASH, it just shows a failure of how that society is working. So many things are going wrong, like you said, from pollution to the environment to food structures to exercise, awareness, it becomes, the liver really becomes that kind of key, that kind of window, into a broader public health issue in few ways, compared to so many other conditions.
So one of the things I loved about your Readiness Index report, and we'll make sure that all the publications are linked as they come out to this episode, people who watch it in the future. I love the fact that it gave a sense of, of countries, where they were. I think when we do a lot of change management in any sense of that, understanding where people are currently, what their readiness is, helping with their receptivity to it is so important before we just sort of rushing in with, we need to do all of these things. So where are people now? So I hope people will look at that and get a sense of where their own country is, and move forward. I just wanted to ask the question, because you do have such wonderful experience in HIV and other areas, in terms of the scalability of some of the programs and plans and interventions, because I know, we each, spend some time with, the most innovative, cutting edge, high tech, new, non-invasive diagnostics and things. And I always challenge my team to think, will such an intervention work in Seattle and Senegal? And so how do we make sure that as we're providing cutting edge innovation and models for NAFLD and NASH care that we certainly want to encourage, how do we make sure that we're not sort of widening gaps and disparities across countries, and make sure that there are effective NASH innovations that work in low resource environments?
Yeah, so thank you for that. We have had a lot of experience in HIV, particularly in dealing with, inequalities, inequities, stigma, and discrimination. So all the issues we face in NAFLD and NASH. And I feel like NAFLD and NASH is where we were a long time ago. I don't know if it's 10 or 15 or 20 years ago in HIV. The good news is that, as non-invasive tests are having better, predictive values and are more, let's say, are more sensitive and specific. Those are low cost tools to diagnose, and so that will help the countries and contexts or geographies where they don't have the access to biopsies. Plus, we want to avoid biopsies where we can, for obvious reasons. So it's been a constant challenge to innovate in NAFLD and NASH. We've been lucky enough to have pharmaceutical companies and diagnostic companies often driving this process, since unlike NAFLD and NASH, we have highly effective treatment or highly effective antiretroviral therapy for HIV. We have rapid tests. So innovation has been just outstanding in the field of HIV. It's been outstanding now in the field of hepatitis C. And I had expected things to move quicker with the development of treatments for NAFLD and NASH, but as those treatments have stagnated and haven't all been as successful as we had hoped, I feel like some of the innovation is lacking a little bit. There are some great research groups and global international groups working, again, in the field of improving diagnostics, improving NITs, non-invasive tests. But I haven't seen huge leaps in innovation. I think one of them will be related to awareness and linking, as I said earlier, the few things we can do for NAFLD and NASH. So, structured lifestyle interventions around diet and exercise, and embedding that in with probably other conditions or non-communicable diseases.
As grateful as I am to be, a mile and a half away from a world-class hospital that I, happen to be on the board of as well, I've become quite enamored of the thought of a tape measure as the best non-invasive diagnostic in NASH, and measuring waist circumference. And I'm like, that can someone in every country can have that, can start with that, and then plug into perhaps some of the things that we'll be all developing in terms of healthy food and structured, supportive in culture, in language, lifestyle interventions, which we know will be needed in addition to whatever NASH medication or combinations of medications come out. So I encourage people to think as low tech and as well as high tech at the same time, because I don't want to leave anybody behind. I want every patient, and I know you do, who is at risk for NASH or has NASH, to be able to access the appropriate service.
So. That's a great example with the tape measure. Not everyone, or at least not all the funders, will necessarily agree that weight circumference and BMI is an appropriate endpoint, but I think for a large portion of the population, just getting weight under control, and it's not just about controlling your weight; it's about what you eat, in general, for other reasons, maybe not necessarily for your NAFLD, but that's a great example. And unfortunately, during the pandemic, that tape measure has been thrown to the wind as much as it might be able to get picked up by the wind, and people have forgotten about that. And we've seen obesity, estimates increasing over the last year and a half, or during the pandemic, greatly. And again, that will, for those who don't have the money, who don't have the kitchen or the ability to eat well, the pandemic has really worsened the situation for their liver.
And especially with children as well. There are a lot of children who are coming out of this pandemic who are normal weight, who are overweight or overweight, who now live with obesity, and we need to make sure that that's addressed as well.
Yeah, pediatric NAFLD is just a whole another area we're hardly addressing. We know that the long-term outcomes are disastrous, but no one's really been addressing it, and we're barely even able to address NAFLD and NASH in adults. But obesity among children, among young people, is really an epidemic. What can I say? And there's so many structural issues feeding into that. And then when you take away their ability to go to gym class at school because they're not even going to school, and there's for those lucky enough to have a computer or in virtual classes and sitting at home, or often in very small apartments or homes. Again, this year and a half has just been devastating.
But thank you for your work and your partnership in shining some light on this, both on the challenge and into the path and agenda forward. And thank you for this conversation today.
Thanks for having me, Donna, and have a great rest of your day. And when we wake up, it will be International NASH Day, and a busy day to raise awareness, or to start the awareness raising for the rest of the year as well. So thanks for your leadership in this area and for thinking of the foundation for this talk.
Thank you. And everybody who would like to hear more about some of these issues that we touched on, there are 8 different panels tomorrow for International NASH Day, and a culinary event in the evening to provide a little help and guidance on liver healthy eating. And you'll find all of that information at globalliver.org and on our Facegram, Twitter, and Instagram. Until next time, please stay well and stay connected.